Hi, my name's Nate. I just had patellar tendon repair surgery on my left knee. And I've been putting it off for 10 months, but couldn't rehab it, so I had to get it done. And I'm putting this on YouTube so that other people who might be in my situation can um, listen to someone else's experience. Um, so basically, it's a long road I've been on. I kind of went crazy because of this, and had to get on some psych medicines, and had to wait for those to kick in before I was ready for surgery because I was just too anxious, too much stress, and now I feel much better and ready to go through this rehab that's supposed to take a couple years. I used to be an athlete, and then this happened, and I became a non-athlete, and it's been really hard for me because I don't know how to not ride bikes and ski and lift weights and stuff like that. So I had to get it done. My surgeon is very conservative with his rehab protocols. A lot of people say move it right away, start strengthening the quadriceps right away, but I am just going to do what he says. You know, I'm 50 years old, so I'm not going to try to rush it. I'm just going to get it healed up in the way he recommends. So just to explain what happened, I was pedaling my mountain bike up a switchback about in November of 18, and I was going up the switchback. I lost traction and I tipped over going 0 miles an hour. Very spectacular, you know. And I landed my knee on a rock, and it hurt like hell. Went directly to the emergency room, got an X-ray. They said it's not fractured, you're good to go. So after about 5 weeks, it was feeling better, and I got back to doing some rehab, and was feeling pretty strong. I still had pain, but it wasn't bad. And then over the next couple 3 months, I just was slowly getting my strength back. I did cancel my ski season because I wasn't sure what the prognosis was going to be. And then I started doing a couple of short ski tours on backcountry skis in January, and it was feeling okay. And then I went on a longer tour in February 4th to be exact. And I didn't feel anything while I was out there. It was hiking and skiing, not a big deal, nothing aggressive. It was cold. It was winter. And I got back in the car and drove home, and I got out of the car when I got home, about an hour drive, and I was like, oh my God, what is wrong with my left knee? Long story short, it was messed up. At first I thought it was tendonitis. Went to the orthopedic surgeon here in Reno, Nevada, and was told I had tendonitis in my patellar tendon. And I, along with that diagnosis, I began to treat it for that, and it just wasn't going anywhere. Then I got a platelet-rich plasma injection about 6 weeks later. So at that point, it's mid-late March, and that did, over the course of probably 16 weeks, that didn't make any difference, which is not the fault of the person who did the procedure. That's just the way it goes. And then I went back to the orthopedic surgeon in April, and I said it's not improving. He just said, it's tendonitis. It just takes a long time to heal. And I was like, okay. So I was like, after I left, I said to myself, well, maybe we don't know what the problem is. So I called him back and asked for an MRI. He said, it's not necessary. You have tendonitis. Just give it time. At this point, I'd given it, a few months. So I decided to ask my primary doctor for an MRI. And he said, I'd rather you go through the orthopedic surgeon. And I said, I don't plan on going back to him. I don't have trust. So so we went around and around, and my primary doctor finally ordered the MRI. Got it done the next day and discovered I had avulsed my patellar tendon on the lateral aspect of the left patella, right at the bottom of the kneecap, which is exactly where it hurt. Anyways, I was told by someone to go seek a surgeon in Carson City, Nevada, which is about an hour from where I live, so pretty big commitment. But I wanted to go with a surgeon who was highly recommended, who's worked with skiers and mountain bikers and weightlifters. And I went and saw him, and he's very nice. And we initially decided that we would try to treat it conservatively, and we gave it another few months. Finally, in August of 2019, I just said, you know what, this isn't getting better with trying to rehab it via physical therapy and such. And it wasn't hurting bad, but it just wouldn't get better. So at that point, my mental health was a lot better, so I scheduled surgery for today, which is September 12th of 2019. And I just got home from surgery. I have a ice pump machine, which I will show you. And that's it. There's the cooler. There's ice and water going through this tube. And there's a wrap under my brace. There's an ice pack on top of that as well. There's the brace. Typical range of motion brace, locked out in full extension. And I'm back. As far as I understand, the surgeon says I am in full extension, no bending for 3 months. And after that, I get 10 degrees a week in the brace still until I guess I get to probably 90 degrees is my guess. Passive range of motion. And then after that, I can start weaning out of the brace. So he's thinking I'll start weaning at month 4, give it a good month to get to 90 degrees maybe. And then after I get full range of motion, which I assume is around 120 degrees, then I can start strengthening the quadriceps and the glutes and the hams and the yada yada below the belt stuff. And let's see, where was I? Very slow, methodical rehab. As I said earlier, my surgeon is very conservative with athletes. He does not try to move them back to their sport quickly. It is a very long process, he said. I'm hoping to do these video diaries of my progress off and on as I'm getting better, and I guess I would assume, or you should assume, that if you're not seeing more videos from me, that I am doing okay, or I died. One or the other, who knows. Currently, I am not in a lot of pain, but I have a local anesthetic, and I have, I think I took a Vicodin before I left the PACU, which is the recovery room, and I'm supposed to take another Vicodin at 10 p.m., which is past my bedtime, but I guess that's just the way it goes. I'm sure pain will let me know. Thank you. So I have a walker. Let me show you that. There's my walker. I have crutches, but they're in another room. They're for going outside. I have a single-story home, so I don't have to worry about stairs too much until I decide to go out to the garage, which is 2 steps, and I got in, so we'll see if I go out at some point, but I'm in no hurry. Through all this, since this began, I've lost a significant amount of weight due to atrophy, actually of both knees. And as an aside, I actually developed a pretty severe other knee injury right like within a month after the February incident. And it took 4.5 months to get a diagnosis. And lo and behold, it was something called Hoffa's superiolateral fat pad impingement syndrome. Kind of a mouthful, but basically there's a fat pad behind your kneecap. And if you're as unlucky as me, you have a situation where the fat pad gets pinched between the backside, outside of the kneecap and the inside edge of the lateral femur. And sometimes people get it pinched between the femur and the tibia. Mine was between the kneecap and the lateral femoral condyle. I believe that's what it says. Very unpleasant, really messed me up mentally and physically. I had 2 knees that were not working, couldn't walk, couldn't for months, and finally it's getting better. I finally got an MRI in August that confirmed what I thought it was, and the surgeon was going to do a arthroscopic resection of that portion of the fat pad, but it responded to anti-inflammatories somewhat, and then my physical therapist is doing a procedure called Graston. I don't know what the full name of it is, but Graston therapy, which uses these metal tools and lotion to grind on the scarred part of the fat pad on the other knee, the right knee. She's not going to be doing any therapy on my left knee for about 3 months. So we're just dealing with the other knee, and it's doing better. This has been pretty hard. I went from riding bikes and lifting weights and skiing pretty much every day of the week to being a non-mover arounder for, well, it's been 7 months. It's been really hard. I really need to be active for my mental health. I think a lot of pro athletes and other athletes really struggle with injury, and especially if they don't have the right diagnosis and aren't improving over many months. So anyways, I should probably cut this off. It's been almost 15 minutes, and this is my first time ever doing a YouTube video, so bear with me if it's not any good. Take care and have a great day.